Hello, this is the American Medical Association's COVID-19 update. Today we're talking about the impact of COVID-19 on transgender individuals awaiting gender-affirming surgeries. I'm joined today by Dr. Jesse Ehrenfeld, immediate past chair of the AMA Board of Trustees and an LGBTQ health expert in Milwaukee, Dr. Lauren Schechter, clinical professor of surgery at the University of Illinois at Chicago and director of the Center for Gender Confirmation Surgery at Wise Memorial Hospital in Chicago, and Dr. Maya Green, regional medical director South at Howard Brown Health in Chicago, and who's actually in a mobile COVID-19 testing unit immediately as we talk. So I'm Todd Unger, AMA's Chief Experience Officer in Chicago. On March 18th, CMS announced that all elective surgeries and non-essential procedures should be delayed due to the COVID-19 pandemic. Dr. Ehrenfeld, gender-affirming surgeries are technically labeled as elective or non-essential and were put on hold. Is this label accurate?
So thanks, John. The language describing this care is unfortunately misleading. We know that gender affirming medical and surgical care is an essential component of care for transgender persons. And access to this care has been consistently shown to improve the health and long-term well-being of transgender persons. When these procedures are labeled as elective or non-essential, it is more a reflection of the acuity of the issue being addressed and the resources that are needed to perform the procedures. As some gender-affirming surgeries require ventilator support or blood products, some were postponed to ensure that resources were available to take care of people with severe COVID-19 infections.
Dr. Schechter?
Well, thank you very much, and I appreciate the opportunity to be on the panel today and hope everyone is healthy and safe. And I agree with Dr. Ehrenfeld. People often conflate elective with cosmetic, for example. Gender-affirming surgeries are medically necessary procedures. They are improve quality of life, function, well-being across multiple domains. So they are absolutely essential services. From the surgical perspective, because of the pandemic, we were forced to triage based on acuity, really emergent or urgent procedures, meaning immediate threat to life or limb. Unfortunately, many surgical procedures are elective, and that includes cancer operations. So we were forced for about 3 months to shut down. Luckily and fortunately, over the past 10 days or so, we've been able to resume surgery, and it's going quite well.
Dr. Green, what are some of the potential consequences of delaying procedures like this?
Oh, potential consequences are enormous, right? Everything from delayed manifestation of a person whose one is to the mental health impact to the societal impact that our gender nonconforming and transgender population experience when walking in the street. It's basically like we're in the middle of a pandemic, right? In the middle of pandemics, the historically groups that have historically been overlooked and underserved always bear the brunt of it. This is just one of the examples, right? To be in a space where gender affirming or life affirming surgery is deemed non-essential is just one of the examples how marginalized populations are further marginalized, unfortunately, during pandemics.
And let me just jump in and say, I agree with Dr. Green, but people are feeling isolated now more than ever. I experiencing that. I'm sure you all experiencing that. Our patients are experiencing that. In my transgender patients, who in many cases have been, waiting years and years, getting ready for procedures to happen. Suddenly, everything's on hold, and unfortunately, we're starting to see some increased substance use and abuse as a result of some of these isolation challenges. That's a result of the behavioral health experience that I think a lot of us are under right now.
Yeah, the intense preparation for surgery and then the cancellation has been quite disruptive to people's lives. As you can imagine, people who may prepare almost for a lifetime for surgery and then to have it kind of taken away from them in quite an abrupt fashion has been very disruptive. We're trying to get back on track. We're not operating at 100% as of yet because of some limitations associated with COVID, but we are adjusting to the situation and ramping up.
Insurance coverage for these procedures was an issue long before the pandemic. Has this become further complicated by COVID-19, Dr. Schechter?
So, over the last perhaps 5 to 10 years, certainly since the passage of the Affordable Care Act, access to care has been expanded dramatically. Probably 85, maybe 90% of the individuals for whom I care are now covered by insurance, and that's distinct. It was almost 90% were not covered 15, 20 years ago. I would say, though, that the insurance companies have made some accommodations by allowing, for example, some of our pre-certification or predetermination to be extended. So we haven't had to go through what can be quite a cumbersome process. Now, having said that, there's a tremendous amount of flux and uncertainty in the healthcare environment. As time marches on and there are potential changes to laws or policies that may be adverse to coverage, that certainly has not been helped by delays associated with COVID.
I'll just add that, coverage still isn't great. There are 30 states where transition-related care by law can be excluded from coverage, which is crazy. People often travel long distances to get highly specialized care that's medically indicated. And I do worry about, 17% of LGBTQ adults don't have any kind of health insurance, compared to 12% of non-LGBTQ adults living in the country. So we still, in spite of gains that we saw under the Affordable Care Act, have higher uninsurance rates amongst LGBTQ people.
Yes. Oh, sorry. Yes. And then if you think about it, another thing that people are experiencing is for the population I work with, I work on the south and west sides of Chicago. And so a lot of my patients who identify as gender nonconforming or transgender were in service industries and worked at companies where there were high layoffs. And so even in spaces where they were able to have that insurance, now that's not the case. And so there is, for my patients, a lot of nervousness about what's to come, what changes they can expect, whether or not insurance will be instituted at that same level. It's really, you spoke to what other ramifications is this decision causing. It's really causing things on a whole public health level.
Yeah, and to add to that, the post-operative care is so important, especially with many of the more complex procedures. So having a safe environment in which to recuperate is so important, and that plays into, as Dr. Green has just indicated, housing, the ability of someone's support system, family, friends, loved ones, to care for people. Some individuals, for more complex procedures, we send to skilled facilities for a week or two to recover prior to going home. That has been delayed because many of those facilities now are caring for COVID positive patients.
So how have you all been getting creative and addressing transgender individual needs during the pandemic while also following state guidelines? And now that states are loosening restrictions, are these surgeries moving forward?
So early on, we began with virtual consults, whether by phone and then expanded into web-based consults. We care for almost 2/3 of our patients travel from outside of Chicago, so we're familiar with coordinating care from far away places, remote places, even international. But the ability to travel, even for an office appointment, has been dramatically dramatically reduced. So now what we're trying to do is still move the process along by obtaining the necessary assessments and so forth, and then scheduling confirmatory or final consults several days before the anticipated date of surgery. So it's a bit more work on our end to coordinate with primary care and so forth, get testing done remotely, and then so people don't have to travel twice to see us.
One thing I would just jump in and say is that, like any medically indicated healthcare, people shouldn't put off and delay care because of a concern about COVID. It's important that people seek the healthcare that they need. And I do worry that people are delaying, putting things off, whether it's related to transgender surgery or not. Probably the safest place to come now is to see a healthcare provider, whether that's in a clinic setting or a hospital where we understand what the precautions are that need to be taken. And so I would just make sure that we get the message out there that people shouldn't be putting off the care that they need.
Yes, if I can just quickly dovetail off of that, and looking at the way we're communicating that, right? When we look at gender nonconforming or transgender population, that's a population that historically details like that weren't written for or communicated to. So we've got some work to do in that area. In addition to things we're doing, Dr. Schechter mentioned telehealth. I know where I work, Howard Brown, we have mobile primary care, which will go to someone's house. We also have mobile integrative health, which is mobile psychiatry services. And we also have telehealth, integrative health, mental health support, where someone can have a telehealth visit or a call. And then we have to remember, when we're talking to people, distributing things like pack lists, like important things like post-surgery. If you have to pack for a long term, don't forget things like dilators and things like that. How to do chest binding. Those things are really supportive of our population pre and post surgery at this time. And then collaborating with organizations that are doing at more local safe spaces for our population to come and talk about support when they're having these barriers to care that are not allowing them to actualize who they are right now, like brave space and life. Yep.
There is guidance that's been issued about when it's appropriate to resume non-urgent services. All of the guidance from CMS, American College of Surgeons, CDC, can be found on the AMA website and the COVID-19 Center.
Well, thank you all very much for being here today. Dr. Green, you are a first-time person who's ever been speaking to us from a mobile unit. So thanks for taking the time to do it. Dr. Ehrenfeld, Dr. Schechter, thanks for your perspective today. We'll be back tomorrow with another COVID-19 update. And as Dr. Ehrenfeld mentioned, for COVID-19 resources, visit the AMA site at ama-assn.org/COVID-19. Thanks for joining us and take care.
Bye-bye.